It was the training that I didn't know that I needed.
Like, I was very closed-minded about it, thinking I knew everything. And I actually came into the training and realized that I knew nothing and left it feeling very well informed.
And I feel that she did a really great job of knowing her audience. It was very relatable.
The way that she used our language and actually took the time out to talk the way we talk and use the words that we use to clarify things, it made it easy for me to take that directly to my participants, because she told me what to say and the way that we would say it.
We were able to leave this full of resources, full of avenues, full of connections, full of people that we can contact to and refer to.
The information was outstanding.
I learned a lot of information about how healthcare is managed and how in some of the communities that are more affected with crime and different things in the community, that health is also a huge thing, and people there are lacking the resources that are needed in order to get proper health care.
I know the language to use to make them comfortable so that they can talk about it, so that they can get on PrEP, so that they can even consider getting on PrEP, or that they can even consider getting tested.
I can tell you that everyone in my office, life was completely changed, whether it's at home, whether it's in the office, whether it's out in the community, based on this training, because I think it touched so much people and it brought it home in a way that it could centralize in a lot of people's lives.
When I first got the call that DKB Med would like to have a conversation with me about getting involved with some of their community involvement, I was really excited about it when I found out it was about HIV. Being able to be a conduit for DKB Med to bring that education to the communities, I think is important. And it really helps because the clients already trust that relationship with the barber. I've been really impressed with the response that we've received. Now you have groups of barbers and even clients now taking PrEP because they want to live a better lifestyle and protecting themselves. And that all has to do with the education they received through this Fade Out project.
We got to test over 400 individuals, most of whom were people of color. And these are people who wouldn't normally come into a place like Babashi or a healthcare agency. But we didn't just provide HIV testing, we provided health education resources, and we also reduced the stigma and raised awareness. So people come in for routine checkups now directly from our partnership with DKB Med. And we actually saw at least 5 to 6 people come in for PrEP. So we had more people on PrEP now coming from the DKB Med partnership. We had more people coming in just for routine testing. And we got to educate the barbers so they can continue to pass the education on.
I think the most important thing is to get educated. If you're educated, you feel empowered. If you're empowered, then you can continue to help.
I remember the conversation as to how DKB Med could support the food sharing here at Sunshine Cathedral. And when I first heard about this, I thought that this is incredible because I see the need here. I also recognize that when there's food insecurity, there's insecurity in other areas as well, including healthcare. We provided fresh produce and pantry staples for between 200 and 300 people, and we tested hundreds of people. They tested for diabetes, they tested for hypertension, they tested for HIV. Honestly, we can't do it alone. So it's really, really important to partner with local healthcare organizations, medical education groups like DKB Med. They know how to do that part of it. It recognized the humanity of these folks, and I don't see a whole lot of that sometimes. I think that if we're going to do something like this, it really does touch the entire person. That is something that's missing a lot these days.
We felt in OSF that the Saving Sight program was necessary and viable, mainly because of the prevalence of diabetes in today's society. We also know by looking at our data that we are not doing an adequate job of screening for diabetic retinopathy in our patients for a variety of reasons. So with this new technology, we were able to put diabetic eye screening right into our primary care practices.
rather than a patient going to the eye doctor in addition to another appointment at primary care. They can get their exam right there in the office while they're getting their medication refilled or their labs drawn.
We now have objective evidence that there's early changes in the retina, and that will really get someone's attention. The other factor is we do have an embedded navigator.
So once the patient understands the importance of getting their eye exam, and they're hearing it from the level of the provider, they understand it a lot more in order for them to continue on and to keep those eye exam appointments.
So this education was so specific and so targeted. I think that's why you see such dramatic changes. So I think those people that took advantage of this learning opportunity really did their patients a favor by brushing up on this stuff.
And when it comes to feedback from the patients, they really like the fact that they can get their screening done in a one-stop shop kind of manner. This screening tool has allowed us to identify 17 to 20 patients out of 100 screened that need eye care specialty attention because of early changes of retinopathy. We have found that a real key to that is to have a physician champion in the practice that really buys into the screening.
Being able to make an impact on one human life is so rewarding, but being able to make an impact on such a large group of people, potentially saving their sight, has been just incredible.
So if you have diabetic retinopathy as the leading cause of visual loss in the United States, and we now have the screening tool to find it earlier, and the earlier you find it, the more vision you can save. To me, it's kind of a no-brainer to pursue this.
I had a regular annual checkup with my general practitioner, and he did some testing and asked me about getting my eyes tested. He shared that I was borderline diabetic and I was just starting to cross over the line, and he really wanted to get the test going and get a baseline read for my eyes and my vision so we can monitor it as my disease progresses.
It makes me feel great that I'm able to help patients detect their if they have diabetic retinopathy, and especially if it's detected early, and knowing that once they get treatment and they're following up regularly with their eye care provider.
In a few minutes it was finished and I had my answer and I could breathe a sigh of relief.
I mean, that's a direct impact on quality of life. That's something that drives us, something that excites us, something that makes what we do every day seem worthwhile.